Katie Nicholson begins our coverage in Toronto at the site of a makeshift care centre. And Katie, tell us more about that.
Yeah, so Ian, this is Sunnybrook Hospital's field hospital, 80 beds here. This is designed for people who are recovering from COVID, and it's to make space in those critical care units for the onslaught of patients that they're expecting. But as we learned today, these measures may not be enough.
Ontario's pandemic numbers have never been this bad.
It's hard. We're stretched. We're tired.
This doctor, already overloaded, now doing all she can to train more much-needed staff for intensive care.
I'm scared that we won't have enough people.
So under the scenarios...
And new modeling today shows the worst is yet to come.
And our progress is both frustrating and frightening.
With current measures in place, the numbers project by the end of May, 10,000 new COVID cases a day, more than double today's tally. Staring down the barrel of a COVID catastrophe, the province today extended the current stay-at-home order to 6 weeks.
And more needs to be done right now.
And announced new restrictions effective midnight. Non-essential construction for things like shopping centres and office towers will grind to a halt. Much construction will continue, including residential. Box store capacity now down to 25%. All playgrounds to close. No more golf, soccer, or basketball. Outdoor gatherings limited to one household. The Ontario border will close to Manitoba and Quebec, but remain open to workers who have to cross. And police will have enhanced power to crack down on people, even pulling cars over to make sure the trip is essential.
If you are not willing to comply, then you are breaking the law.
The fine for non-compliance, $750. Criticism came swift and sharp from the medical community.
We're implementing measures that are totally contrary to what public health is about and what the best experts are recommending we're doing. And so that unintended consequence would be, that this is going to disproportionately impact our racialized and vulnerable communities.
As field hospitals and treatment tents pop up in major centers, it's an open question who will tend to the patients in all those extra beds. Ontario has asked other provinces for help staffing. The Prime Minister says Ottawa can help with lab support and contact tracing.
For Ontario, we've shipped out more healthcare equipment, like oxygen units and drugs to treat COVID-19.
And they're ready to pitch in with more resources, including Red Cross teams to help distribute vaccines. But Ford says he doesn't need people. He needs vaccines.
And we're going to take a closer look at that claim in a moment with Rosemary Barton. But first, Katie, there's more criticism of Doug Ford's restrictions emerging tonight.
Ian, none of the medical experts I've spoken to ever wanted to see playgrounds closed down. What they wanted to see was paid sick days for the precariously employed essential workers. They wanted to see factories shut down that aren't producing essential items. And the other thing we're hearing from is civil liberties organizations. They are worried that people of color are going to be disproportionately affected by these broadened police powers, and we may see a number of racial profiling incidents, or at least an increase in them as essential workers move on and go to work under these new conditions and get pulled over. Ian?
Katie Nicholson, just outside the temporary care centre outside Sunnybrook Hospital in Toronto.